Okay, I think we will get started. As I mentioned, we have one more speaker who's just responded to me saying that they're going to join very shortly. So I don't want to keep you all waiting any longer. I'm going to share my screen. And Mercedes, can I just get a quick thumbs up if you're able to see my screen there? Perfect. All righty, fantastic. Okay. So just a heartfelt welcome, everyone. My name is Brian Wong. I'm a general internist at Sunnybrook Health Sciences Center and the director for the Center for Quality Improvement and Patient Safety. And I'll serve as one of your co-facilitators today. And I'll let my other sort of co-facilitator, Patricia Tribovich, introduce herself right now as well.
So hi, everyone, and thank you so much for taking the time to be here today. So my name is Patricia Tribovich. I'm an associate professor within the Institute of Health Policy Management and Evaluation at the University of Toronto, and I also hold the Badeau Family Research Chair in Quality Improvement and Patient Safety at North York General Hospital.
And so we're just extremely excited to be able to welcome all of you to this first of hopefully many meetings that we'll have together. And this really serves as the introduction of the TAHSN community to the new Quality Improvement and Patient Safety community of practice. We'd like to first begin with an acknowledgement of the land on which we work, study, and live. We recognize that many Indigenous nations have long-standing relationships with the land upon which the work of TAHSN is conducted. We acknowledge our presence on the traditional territory of many Indigenous nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, this land is home to many diverse First Nations, Inuit, and Métis people, and we are grateful to have the opportunity to live, work, and gather on these territories. Land acknowledgements are only a starting point for larger conversations. More concrete acts of restitution and transformation are needed to address underlying inequities and blatant discrimination in the distribution of resources between Canada's First Peoples and settlers. So as I mentioned earlier, Patricia and I will serve as the facilitators of today's session. And we have as an agenda the following outline. So we're going to have first welcome Drs. Andy Smith and Dr. Audrey Laporte to make some opening remarks very shortly. We're then going to provide a high-level overview of what the rationale for a TAHSN quality improvement patient safety community of practice is, and how it fits in within the existing TAHSN structure, what we anticipate the main elements of the TAHSN QIPS COP will include, and a brief overview of the initial work streams. And really the entire intent here is to provide you with a sense of what it is that we're hoping to accomplish and provide you with the necessary information to decide whether or not you'd like to engage in a more deep way. There's going to be lots of time for us to answer questions as well. And so just, I did note from when we saw all the people that signed up that we had people from all 15 TAHSN member organizations. Interestingly, also some people from outside of TAHSN wanting to learn about what we're up to. And so for those of you who are not a part of TAHSN, it serves as a leader in Canadian healthcare. It's one of the largest, most productive academic health networks in North America. As evidenced on a number of dimensions, including academic standing, research activity output, visionary collaboration, and contribution to healthcare innovation. And it's on this foundation that we're excited to build this new community of practice. So I'd now like to turn things over to Drs. Andy Smith and Audrey Laporte, Drs. Andy Smith and Dr. Audrey Laporte to make some opening remarks. And for this portion, I will actually stop sharing my screen. And I think we'll start with Andy.
Great. Brian, good afternoon, everybody. Brian, can you hear me okay?
Yep, we hear you great, Andy.
Perfect. I'm in the basement over at Humber River. I just ran over from Sunnybrook for a staff barbecue celebrating the great team over here at the Reactivation Center. So I see there's a lot of attendees. So first of all, welcome and congratulations to you and all, the entire COP. team for coming together. I think that's great. And I think for my opening remarks, I'd really like to make 2 points. One is just how terrific this is as a manifestation of a network. And secondly, I'm going to talk to the practical impact on patients and families and the teams that help provide care. So as you pointed out, Brian, TAHSN as a network is 15 organizations, 14 hospitals, and the university, but it has never been stronger. And I think there's a lot of reasons for that. Certainly new members, including Humber River Hospital, by the way. And I think that's been amazing. But what is special about quality improvement, patient safety, people and teams is that all 15 of the sort of components of the TAHSN network, whether the hospitals or the university, have people and teams that are deeply involved in the enterprise of quality improvement, patient safety. So there's a lot of areas where we team up and we are better than the sum of our parts. But I'm hard pressed to think of something where there's such a deep and abiding interest as there is in quality improvement, patient safety. And if you look across the waterfront in this area, it's something that enthusiasm is only growing. I don't want to digress too much, but it's incidentally impressed me a great deal to see how the quality improvement, patient safety people and teams are also sort of really touching the green and sustainability work as well. Perhaps that's a topic for another day. So I really think that has been great. And the second part, and I know that Audrey will focus on a different aspect, but what's really important is that as a network, we have the opportunity to, across the city and beyond, as you've said, there's some people who are outside of the network here. We really have a special opportunity to learn from one another, to co-develop better ways of taking care of patients, providing quality care and improving the processes and outcomes related to care. So I think there's very practical, real, and immediate impact that happens as a result of this community of practice bringing people together. So I'm privileged to serve as the chair of TAHSN right now. We have our next TAHSN CEO meeting this week on Thursday. And I will just say, I know these are early days for your community of practice. You have wildly exceeded expectations already, and even just the number of people, 150 or whatever it is here right now, is spectacular. So I wish you all the best. And I know I speak for all of the TAHSN CEO table. You have not only our attention, but our great enthusiastic support. And so well done and carry on.
Thanks so much, Andy. And I did fail to mention that he, beyond being the CEO of Sunnybrook, he is the TAHSN chair and really would not be where we are in terms of our community practice without his vision, his support as a leader. So thank you, Andy, for this opportunity to engage at the TAHSN level. Now, Dr. Laporte from IHPME to make some opening remarks as well.
Thank you so much. Hi, everybody. It's wonderful to see so many people here and showing their support for this important initiative. So it is indeed both a pleasure and a privilege to be here at the launch of the TAHSN QIPS CoP. As has been noted, TAHSN is a world-leading network. It has kickstarted and led a wide range of innovations across practice, training, and scholarship. And IHPME in U of T has had a long history of partnership and exchange, not just within TAHSN, but also with its constituent members. And so we have this tradition, this history of multilateral positioning of faculty, research scientists, students, trainees, planners, decision makers, and programs of research, which serve as a testament to that, the strength of those relationships. And in that sense, this COP in QIPS is a natural next step. It's an outgrowth of these existing connections, and it represents an important opportunity to crystallize that expertise and resources and talent across TAHSN. And it will enable and facilitate a knowledge exchange, as Andy noted, between the practice settings and the academic world. So it's not just academia that transmits knowledge, but the practice settings have an important role to play in signaling the priority of problems and issues that need solving, what will be required to solve them, including things like data and information. And it also is an important impetus to push the advancement of methodological techniques, both qualitative and quantitative, and to get us to rethink some of the conceptual frameworks that we're using, which will facilitate implementation and evaluation of the solutions in order to improve outcomes. So congratulations on this launch to both Brian and Patricia and the whole of the COP team. We're really excited about the opportunities that this COP will unlock and to continue to engage at all levels with our partners across TAHSN. Thank you so much.
Thank you very much. And we're just so excited to be able to launch today, as I mentioned before, and for both of you for your kind and supportive words. And we know that we have the support of all of the leaders within TAHSN to do the important work that we hope to do as part of a COP. So I'm going to turn things over now to Patricia, who's going to talk about the rationale for a quality improvement patient safety community of practice at this juncture.
So hello, everyone, and thank you again, Andy and Audrey, to both of you for those inspiring opening remarks. So yes, what I'd like to do now is just give a quick overview of the rationale, the impetus for this quality improvement in patient safety community of practice. And I think one of the things is that it was actually pretty straightforward to get this approved by the TAHSN board, because it was somewhat surprising that we didn't already have a community of practice focused on quality improvement in patient safety within TAHSN. And I say that, next slide, please, because as we all know, we have individual hospitals that TAHSN serves, which are working on QIPS initiatives, but far too often we work in silos. And so the idea with this community of practice is that we can come together as a collective. And next slide, please. We see TAHSN, this community of practice within TAHSN, as a platform to work on, where we can come together, work on mutually reinforcing activities. So together we can move the needle on some of these stubborn quality improvement and patient safety challenges that we all face. Next, please. And why now? I think the short answer for it is that it's the moment for collective impact. We continue to face global challenges where we know that the way that we're currently doing things isn't working, especially around topics such as how are we advancing equity through quality improvement in patient safety. And so I think we're at this really interesting point in time where perhaps more than ever, people are realizing that we have to come together as a collective to tackle some of these issues. And there's also the realization that the pool of resources that we have access to as QIPS professionals is not necessarily going to get bigger. It might in fact shrink. And so as a community, we're wrestling with this question of how can we try to do more with less? And we're starting to see people step up to that challenge. There are already existing networks of QIPS folks who are working together. And so we see this community of practice as a way to build on those existing networks so that together we can achieve positive, consistent impact at scale and in a sustainable way, and hopefully achieve more impact than we have in the past. Next slide, please. So ultimately, our three objectives are to strengthen the current connections amongst the QIPS community, leverage our unique strengths and areas of expertise. And we've identified some areas, priority areas for collaborative action. I'll just quickly mention them right now, and then subsequently we'll discuss them in further detail. So the first work stream is on advancing equity through quality improvement in patient safety. The second one is enabling multi-site QIPS initiatives through better data sharing. And the third one is on improving patient safety. And actually that third one is a perfect example of where there's already existing networks of folks working together on addressing QIPS challenges in our operations in our hospitals. Next slide, please. So, you know, with any community of practice, the ultimate objective is to have collective impact. I mean, that's why we're coming together as a community, is to ensure that we can have collective impact. And So there are different models of working as a community collaboration that we could use, but I just thought I would show this one because I think it highlights some of the key functions that we're hoping to serve with this community of practice. So if I can draw your attention just to the top left, the first thing that you need is a backbone coordinating organization. And in fact, in the literature, this is often the function that is shown to be missing. So people start to come together, but then things kind of fizzle out. And so the idea with this backbone organization is that it's what ensures that cadence and that momentum throughout. And so we're really fortunate to have TAHSN and this community of practice acting as that backbone organization. And then of course, we need a common agenda for change. We need to come together behind a common objective and have a common vision. And then we need to measure our results. In order to know if we're successful, in order to know where we're making mistakes, we need to ensure that we're measuring the same things. And then of course, we need to be working on mutually reinforcing activities. And that's why we've already identified, at least to start, 3 main priority areas of action, and not only to work in silos, but to really cross-fertilize across those three work streams. And then finally, we need open and continuous communication. And so again, we're really fortunate because we have a whole communications team who will ensure that we have transparent and ongoing communication within this community of practice. So in a nutshell, this is just highlighting some of the key functions that we're hoping to serve. And then next slide, please. So I just wanted to say that we're not a formal committee within TAHSN in terms of governance, not in the same way as, for example, TAHSN Education, Research Practice, or Medical Affairs, but rather we're this self-organized community of practice, such as the ones that you see on the right side of this figure here. So thanks again. And with that, I'll hand it over to Brian to talk about some of the elements of the COP.
So the main elements of the TAHSN, QIPS COP are definitely going to be an evolution over the next 6 to 12 months. But we've actually put a lot of time into planning what we anticipate will be the early activities that will commence really in the fall at the broader COP level. And in terms of the work streams, work is already underway. So I would be remiss if I didn't acknowledge the fact that there was a team of individuals that have actually been working together for the past 8 or 9 months to actually put a proposal together to present to the TAHSN CEO table. And that presentation occurred in February. And as a result of the approval, we've been able to identify that it was determined that Patricia and I would co-chair the community of practice along with Andy, who is going to be the CEO sponsor. We have a project manager, Mercedes Magaz, who really will be the individual that will be the point person for the community of practice and will be able to field any questions, concerns, and help with coordination, as well as Amber Doherty, who's the communications lead for CQIPS and will be helping to support communication. As Patricia mentioned earlier, open communication and continuous communication is really critical to the success and ongoing nurturing of a COP. And then with respect to the steering committee really comprises individuals who are going to be helping to facilitate the initial 3 work streams. And so you'll see that there are 3 directors of quality, Bridget Hales at Sunnybrook, Winksy Luck at UHN, and Marie Pinard at Women's, Jeff Powis, who's the medical director of operational excellence and innovation at Michael Guerin, and then Amol Verma and Fahad Razak, who are the Gemini co-leads, who are going to really be helping to facilitate the multi-site initiatives enabled by data. And we anticipate that this steering committee membership will evolve over time as well as the community of practice grows. In terms of the core elements, we plan to have bi-monthly meetings, meaning every 2 months. We hope to have a meeting like this one, which at least for now will likely be virtual. As much as I know there's huge advantages to being able to come together in person, we actually heard from our membership that running these meetings virtually actually improves accessibility, especially for sites that are distributed. And so for now, we are going to leverage the virtual technology, but at the same time, try to enable networking through other mechanisms. And we hope that this will be an opportunity for TAHSN member sites to showcase initiatives that are of broad relevance to the COP, to create a forum to discuss quality improvement, patient safety topics and challenges that hospital teams are struggling with. A forum for the work streams to provide updates on their initiatives and get feedback and input, and a platform to really generate and share new ideas. And so, as we mentioned before, the 3 work streams that we identified are really just the first 3. And we really do hope that other work streams will emerge based on a common interest and where we see there might be opportunities for collective impact. The other core element will be one of information sharing, and this will be sort of leveraging a variety of different communication channels, including a newsletter, a website, as well as social media. And one thing that we've heard loud and clear is that many people want to know about what are the upcoming events that are occurring, courses that are available, educational opportunities, funding calls. And so this will be a place for people to learn more about what's happening with respect to quality improvement, patient safety within TAHSN. A question often comes up, which is, how does a work stream relate to the broader community of practice? And we sort of define the work streams as areas of more focused sort of interest and collective action that relate to broader interests of the COP. And as I mentioned before, we do anticipate that there will be new work streams that will emerge, and we really do welcome suggestions that people might want to bring forward. Of course, suggestions often will then relate to kind of a more sort of explicit and concrete plan of action. But what we're really hoping is that this forum will provide a platform for new work streams to emerge so that we can really tackle some of the areas of cross-cutting interest that affect multiple TAHSN partners. The other key piece, as Patricia mentioned earlier, is that quality improvement, patient safety, community practice is really seeking to foster connections. And a lot of times COPs, the attention is paid to all the formal mechanisms, the meetings that we have, or the newsletter, or the social media. But in fact, the informal connections are just as important. The informal connections may be less visible. They may be the one-on-one exchanges that occur. Maybe some of you are privately messaging each other right now in this meeting to reconnect. Maybe some of you will think, oh, I just saw this person online. I haven't talked to them in a year. I'm going to reach out to them and reconnect. All of those connections are extraordinarily important to build a vibrant community of practice. And our goal will really be to try to foster both of these types of connections. And so, at least for now, that is what we're planning as the initial these are the initial components of our QIPS community of practice. And based on feedback from members and of this community, we will continue to grow the community of practice in directions that make sense for our purpose and our collective need. So I'm going to hand things back over to Patricia, who, along with Bridget Hales and one of Amol or Fahad, will talk through and provide an overview of the 3 work streams.
Thanks, Brian. So in terms of the first work stream, it's the one focused on advancing equity through quality improvement in patient safety. So next slide, please. As Dr. Shivashankar said, there's no such thing as high quality, safe care that's inequitable. Inequity in healthcare is a structural-based problem that requires a structural-based approach. And so that's really the lens with which we want to approach this work stream. It's we often say that, equity is already formally part of one of the 6 dimensions of quality, but it's often the forgotten one. And so the idea with this work stream is that we know that there are many other folks who are currently working on equity-related issues. And so we want to work with other TAHSN COPs, as well as with the Faculty of Medicine, Dalla Lana School of Public Health, and many others around this issue. As first initiatives, what we thought we could do is really think about how we can incorporate equity into our existing methods and tools that we use in quality improvement and patient safety, and also in terms of how we can integrate it into the education and training that we provide. But these are just starting points. What we really want to do is hear from you, what is important to you. So we're really looking forward to working within this work stream to identify other key areas of interest. So with that, I'll hand it to Amol, who will talk about work stream number 2.
Thanks so much, Patricia. So workstream number 2 is really about thinking about or recognizing that our quality improvement patient safety initiatives will require data, and thinking about how we can leverage the various existing multi-site data initiatives that already exist. And interestingly, also to start thinking about how we could potentially bridge these various initiatives. And so, on this slide, we've highlighted a few from the outpatient, inpatient, critical care, surgical settings, but recognizing that many existing collaboratives exist or data sharing initiatives exist. And essentially what we'd like to start with this work stream is beginning with an inventory. So if you are involved in any multi-site data sharing initiative where the data could be used to support quality improvement and patient safety, please reach out, please get involved in this work stream so that we could start there. As an example, the Gemini initiative, which Dr. Fahad Razak and I co-lead, is an initiative. If we go to the next slide, please. It's a data sharing initiative in which we collect electronic clinical data for all medical and ICU admissions across actually 30 hospitals, about 10 to 12 of which are within TAHSN. The data are all shared sort of centrally in a cloud-based computing environment, so that can then be made remotely accessible to analysts for QI initiatives or to scientists and students for research initiatives. And so, Fahad and I are very committed to supporting this COP through Gemini, and we're really excited to collaborate with people who are working with other data sharing initiatives so we can sort of put together the whole inventory of these opportunities and connect and collaborate our data so that we can use it to support QI and PS. And I believe one of the early opportunities may be to do some work around prevention of delirium, and that's something I think we'll talk about in a future COP session. So I'll hand it back over to Bridget.
Thanks, Amal. So the next slide, please. So the third work stream leverages an existing patient safety collaborative that was first established about 3 years ago at the request of one of our colleagues who, from UHN, Wing Silak, who might not be here today because they're in epic implementation mode right now. And so, the idea really came from her desire to help us to connect better on a common approach to patient safety. And it was largely built on the journey that UHN and Sick Kids were undertaking towards becoming a high reliability organization. So lots of lessons learned there that were at the core of bringing this group together. And we've grown over the last 3 years from a small handful of organizations to more than 17 participating organizations, some within TAHSN, some outside of TAHSN. Next slide, please. And so, our ultimate goal is obviously to work together towards identifying some collaborative targets for prevention of harm, but recognizing that in order to do that and in order to be on the same path towards that common goal, we really need to be starting from a common place and speaking the same language. And so, we really wanted to be moving towards being more transparent and sharing our data and outcomes from safety event reviews, but needing to make sure that we're applying common tools and a common approach and using a common language in order to sort of have confidence in our ability to collaborate. Next slide, please. We're taking I'm going to say, slow and deliberate stepwise approach to achieving that goal. And we're really starting with, as I said, from a place of transparency and alignment in our data, and moving towards alignment of our methods and approaches to analyzing and understanding safety events and making sure that we're comparing apples to apples as a next step on our goal towards phase 3, which would be identifying some common goals for harm prevention. Next slide, please. So in just a quick word on sort of our journey to date, because as I said, we've existed for 3 years and have been taking some slow steps prior to COVID, really to sort of come together and establish a common purpose, We had some great education on the serious safety event classification system, which is what we're moving towards. And thank you to UHN and SickKids for providing us with that early exposure to the model. We've shared cases and developed action plans and a bit of a driver diagram to help keep us focused. And of course, all of that was put on hold during COVID, where we ended up meeting just to have sort of huddles and manage things that were emerging. But we look forward to getting back on track. We had a meeting recently in May to sort of recommit to this purpose, and we look forward to sharing that with new members who join us after today.
Thank you, Bridget, Amol, and Patricia. And I'll take over from here just to highlight the fact that, you know, if we go back to this sort of framework of what we think are the key elements of the community of practice, what our hope is eventually is that we will be able to enable cross-cutting collaborative quality improvement initiatives. And ideally ones that cut across the various work streams. And like I said, maybe even work streams that don't currently exist. And it's through these bi-directional arrows, you know, that we deliberately use these bi-directional arrows to really just try to signify the crosstalk that's intended to occur between the broader of community practice and the work that's happening within work streams and the work that's happening within work streams and these cross-cutting initiatives. And so really the hope is that this platform will enable these types of collaborative initiatives that previously we knew there was a desire to work together, but maybe there hadn't been that sort of formal structure to allow and enable it to occur. And so that's the hope that we bring forward as part of this planning for the community of practice. Now, we're going to open things up for questions very shortly. I'm just so thrilled that we have almost 160 people online right now. And some of you may be asking, how do I get involved, or how might I get involved in this work? And so with respect to the broader COP, essentially anyone who signed up for this information session will continue to receive information about activities, updates, initiatives, which means that for the bi-monthly meetings, you'll receive information about when those are scheduled, and you'll receive the information on how to join. If you don't want to receive that information anymore, those emails will include an opportunity to unsubscribe, and we won't email you that information anymore. We recognize that some of you on this call may have received this Zoom link from a colleague saying, hey, you might be interested in attending this meeting, in which case you never signed up with us originally. And so if that's the case and you'd like to receive those updates and that meeting information, you can either go to the link, which is going to be put in the chat, or you can use your phone and access the QR code. And it's a very simple Google form or some type of form that will allow you to enter your name and your email, and then you'll be added to the list. The other thing that we would just ask you to do is if there's anyone within your network, so within your organization or within your team that you think would want to be a part of this, please feel free to forward this link to them, and they can register as well, and then they can be apprised of all of the meetings, activities, and they can receive the newsletter and other information relating to this broader COP. As Patricia mentioned earlier, the idea is membership at this level is extraordinarily flexible, it's extraordinarily inclusive, and at this point, you know, and that participation is mostly passive, although at times there will be ways in which that you can engage more actively. If you're interested in joining one of the work streams that we talked about, so we mentioned the equity work stream, the data work stream, or the safety work stream, again, we want to be very inclusive. And so anyone who's interested in joining this work stream can indicate their interest by signing up on a separate form. Okay, and again, you can shine your phone on this QR code or use this link to access it. And actually, if you just go to our COP website, the links are there as well, so that's very easy. I just want to remind you that, again, involvement in a work stream does sort of require a bit more sort of active participation, in that, you know, some people will actually be rolling up their sleeves to work on these initiatives, to provide feedback on them, to review documents. And that's not intended to deter anyone, but just to kind of let you know that that's sort of the level of involvement that I think the workstream leads are looking for. And so if you're interested, please feel free to sign up. If you're not sure, at the end of this presentation, we'll have an email address for Mercedes, who you can email, and she can answer any questions that you have that we haven't yet answered today. And so at this stage, we'd really like to open things up. We've got about 20 minutes or so now for people to ask questions, to share their reactions. I would encourage you to either put questions into the chat, or you can feel free to use the reactions button to raise your hand, and you can unmute your microphone and answer, ask any questions that you might want to ask. And so the first question I see is from Rosalie Steinberg, which is, can you sign up for more than one work stream? Absolutely. So the sign up form actually is set up so that you can actually choose 1, 2, or 3 of the existing work streams to indicate your interest if you feel you have the time and energy to contribute to more than one. So yes, absolutely. Will we share the slide deck? So yes, we will definitely share the slide deck. So we will make the slide deck available. I'm looking to Amber, maybe we'll make it available on the website. And then we're also going to make the recording, available for people who want to view the recording as well. So the question about the workstream leads or organizations. So, you know, we've been sort of reflecting on what the role is of the individuals that are going to be helping to support the work streams. And I think, you know, the way that we've been sort of framing this is that the individuals are really facilitators of the work stream work. And so for equity, Patricia Tribovich and I will be facilitating the work that's occurring within the equity work stream. Fahad Razak and Amol Verma will be facilitating the work related to data, and Bridget Hales, Wingsi Luck, and Marie Pinard will be facilitating the work happening within the safety work streams. I'm wondering if I could ask Bridget or Marie to answer the question that Sharon has around the patient safety work stream with some examples of what you expect will occur within this group, and especially since I know this is building on an existing sort of group that have been working together already.
Yeah, happy to. And then Marie, if you can add as well. And I see Farah here as well. So maybe Farah Khan can also speak to some of the work. So hi, Sharon. So because we started many years ago, it was really focused on a desire to have a common taxonomy and a common approach to understanding safety events. So a very operational focus and not yet in the point of choosing shared harm prevention goals, but really where we started and the common goal that we identified at the outset was to work towards the adoption of the Press-Ganey serious safety event classification system that really shifts the focus of understanding safety events away from level of harm, which most of us use the WHO classification of safety events based on level of harm, and shifts the focus to more of a preventability focus. And we wanted to establish some sort of goals related to how we might simplify the ability to share safety events, knowing that there's QCIPA legislation that prevents us from sharing certain pieces of information, help establish some common sort of privacy agreements and data sharing agreements that would help us to be able to be more open in sharing safety events and our learnings from those. So the organizations that have signed on to participate have received some preliminary training around this model. And I can include the link to the white paper in the chat potentially as we go through the Q&A. but they have started down the path towards looking at their operations internally and deciding how they might sort of shift to that model. Just as an example for what Sunnybrook is doing, our internal team, it's actually the risk management team who does all of our serious safety event reviews and reviews all those events. They've begun using that classification system in the background, and many other organizations have attempted that as well to try to determine and get some inter-rater reliability there, with the goal of moving towards a 12-month rolling rate of our serious safety events. So the goal is to eventually kind of align our methods and use common tools and have common training for those who operationally manage patient safety in organizations, and then we can sort of pick some common harm prevention goals. I don't know if Marie or Farah want to add anything.
Nope, that was great.
Yeah, hi everyone, Farah Khan, Director of Quality Risk and Patient Safety at Trillium Health Partners. I get the privilege of working with Bridget, Wingsy, and Marie. Honestly, it's a privilege. I'll just say this, that, you know, as an organization coming into the circle on this collaborative, I think one thing we learned is we all classify patient safety incidents slightly differently, and then we focus our improvement efforts almost in duplication. And I think through this collaborative, if we aligned on how we classify incidents and then how we actually focus our efforts on improvement, we could collectively actually move the dial, if you will. And because we often see the same themes and same repetition. And Kaveh, you're here, so I just have to recognize, because Kaveh was our keynote at our Patient Safety Week last year. And we also recognize that we're also kind of spinning a wheel. And so there's an opportunity for us to align and collaborate together.
Thanks so much. The next question is from Katrina Piggott, who's a geriatric medicine specialist at Sunnybrook, asking about vision for data sharing across institutions. So I'm wondering if Fahad or Amol wanted to take this question and speak to some of the challenges obviously related to data sharing, which I know some groups have been able to try to start to tackle.
Yeah, I'm happy to. Hi, everyone. I think the honest answer is the structural barriers for data sharing are very high and complicated. And although there's been a desire to have flattened access for this kind of thing across hospital networks or partnerships, or even access to data like ICS data, it's been very difficult and it hasn't moved very quickly. And so I don't know that we should necessarily hope, although it is an important aspiration to get this to happen, that there's going to be a big change in broad data sharing across these institutions. That said, there are really important opportunities to leverage existing data sharing across these institutions. So rather than having like a broad, flat agreement, I think probably strategically we should look to the organizations and the kinds of data that are being shared. So for example, if you're interested in surgical quality, then the OnSquint data, which is a major Ontario health program, a lot of investment from this province around that would be something to look at. If you're interested in primary care, then the Utopian or Poplar networks, which are really up and running across multiple TAHSN sites. And if you're interested in in-hospital medical care, then us at Gemini, just as an example. So I think that's where the most opportunity is, at least in the short term, while keeping an eye on that long-term goal, which is very important, which is where my heart is.
Mol, did you have anything else to add? No.
I think the only thing I'll say is one potential opportunity for the data work stream is to provide easier access or channels for being able to access the data from those existing collaborators, because it's not always easy to know who to go to or how to get access to the existing data. So I think that's something that we could probably work on trying to do better.
Yeah, one thing we hear a lot from the quality improvement side is that it's hard to get the data, it's hard to access the data. And, you know, on the data scientist side, it's sort of like we have access to the data, but how can we demonstrate improvement? And I think this is where the combined efforts could be really exciting, because we have now data, and if we can leverage that data, actually demonstrate meaningful improvements like we've been trying to and then we've seen some examples where this has been effective. And so can we learn from those, right? And I think that's one thing that we hope to do by bringing people together. So there was a question here around speaking more to the vision for the equity stream and how we hope to approach our work. I don't know, Patricia, if you wanted to speak to that, or if you wanted me to speak to this. We did have our first meeting of that work stream actually late last week, so we could speak a little bit to how that how we started that conversation.
Sure. Yeah. Well, I can start, Brian, and then jump in. I think one of the things that we've started to realize is that we know obviously that care varies as a function of social determinants of health, but oftentimes we know this because there's been focused studies that have looked at this, and those are great. We definitely need more research, but we also know that it's not like we can just go and search our incident databases in our hospitals or our patient complaints or trigo tools or whatever mechanism we have for looking at safety events. We don't have a good way of looking at how these events vary as a function of social determinants of health, because, well, first of all, we don't necessarily collect the data in that way. And so that's definitely one area that that we're looking to see how we can change the way we structure our data collection in that way. But it was really interesting to hear at our first meeting last week just about different many different levels of topics that people are talking about, like even in terms of our hiring practices. How do we integrate equity into our hiring practices the same way across all TAHSN hospitals? Or how do we ensure that the way that we're delivering care in our EDs is equitable? And so I think there's a range of topics, and that's what we're really interested in continuing to hear from you in terms of, like, what are some of those main pain points that you want to start addressing, because we know there's no lack of things to address in this area.
Yeah, and then I guess the last thing I'll just say is that there are several of us are quite involved in delivering quality improvement training and oversee the types of training that are offered within the Toronto community, either at the Center for Quality Improvement or at IHPME. And we know that we have an opportunity to imbue so the principles around equity and inclusion at this stage of training for individuals who are learning about how to engage in quality improvement work. And we know that that's actually more than just adding a single session. We know that's more than just saying, you know, we need to pay attention to equity. It's really changing, you know, who are included as faculty. It involves faculty development in making sure our coaches are well versed in the principles and theories around equity. And then I think, to your point, Nazia, is actually partnering with our organizations and our health system leaders to really address some of the structural elements. You know, if we teach people how to address equity concerns, but we're not addressing those structural elements that give rise to the inequities that we continue to see, then, you know, it will just continue to be a very sort of challenging and I think not very fruitful sort of endeavor to try to just teach people how to create changes that are inequitable or more equitable when we have inequitable structures. So I think it's going to be a long game for sure. And I think the types of questions that we're seeing in the chat and that you raised, Nazia, are the types of questions that we hope individuals within the workstream will raise so that we can have those critical conversations, but not just have conversations that, but conversations that lead to collective action to address some short-term sort of initiatives.
Yeah, I just want to echo that point, Brian. I see a lot of people on the call who are past students from the different programs, and I think we'd all agree that it hasn't been a topic that we've really integrated into our teaching, even in terms of how we run a PDSA cycle. So these are definitely things that we need to work towards. And but on the positive side, I think it's really nice because one of the things that we see is that through these programs, we have a cadre of people who want to continue working on quality improvement, patient safety. So it's nice to see such a big community interested in this.
The next question is from Payam, and I'm wondering, Payam, if you wouldn't mind unmuting and just sort of speaking to what you were hoping to sort of get input on in terms of the visionary sort of health system for Ontario.
Sure, thank you, Ryan. The question actually is sometimes we in every hospital has I think sometimes maybe limitedness in activities and providing the outcome the health system is, you know, across Ontario. My question is, if we could reimagine, redesign a health system, the best or optimum health system across Ontario, and then redesign or redefine the role of each hospital in that, you know, vision.
Yeah, and I think it's a great comment. And in truth, I think this is where it's important for our community of practice to be aligned and connected with the work that's happening at the broader level within TAHSN. So I think it's important because I think TAHSN then connects up to Ontario Health. And all of these groups are trying to, I think, in different ways, define what that vision is. And I think that we have an important role to play as a community of practice in helping to support the definition of that vision. And so this type of question, I guess, Payam, is the type of question we would love to bring forward to the community of practice and for us to have some dialogue around it. And if there are opportunities for us to harness some different perspectives on these types of issues and then channel them towards the health system leaders that have the ability to leverage change, then that might be a function that the community of practice might be able to serve in the future. So it's a great example, I think, of the type of topic that we hope we can discuss further in the coming months. Bridget, I just noticing here, I don't know if that was more of a comment or just in relation to a previous discussion there.
Yeah, it was just to add on the clarity around the patient safety work stream that during COVID, when we put our big goals on hold, we had a monthly huddle that emerged and served a different purpose, but I think is equally useful. And so anybody who signs up for work stream 3 will sort of automatically be slotted into both of those things.
Great, thank you. And then Marie has, oh, sorry, go ahead.
Oh, sorry, I just want to say I'm getting some personal texts about like different tools that people have. So it would be great if you can share them with everyone, because this is really what we're hoping that this community practice will achieve, is that any ideas that you have or tools that you're currently using, that we can share them more broadly.
Yeah, and actually that was a point of conversation last week in our planning meeting, is how are we going to manage this repository of tools and materials? And it's something that we're going to sort of hope to build over the course of the next few months, just understanding what works best for folks. And yes, and we do get the sense that, again, many organizations have some very useful tools. And I think, Aaron, you just put an example here in terms of different policies. And again, so as we have these conversations, it would be great for people to, if they're willing to share them, because I think that we can start to look across the different tools, look for commonalities, look for differences. You know, using a QI mindset, when there's variation, there's opportunity for improvement. And so if we can look across these different tools, we can identify maybe there are some areas that where some places are leading, and we can take those leading best practices and disseminate them across different organizations through this platform. I just noticed that Marie put the paper up that she was referring to earlier, and thank you, Mine. We would definitely love your involvement in the equity, as anyone who might be interested in this work. And Fahad provided just some clarity around what some of these other data sharing platforms are within the TAHSN community. Alrighty, we just have a few minutes left, and so what I'm going to do is just maybe just conclude with, again, a slide that provides you with the links to the broader community of practice as well as the work streams. And if you have interest in signing up for either or both, to please follow these links. They will also be provided in the follow-up materials and available on the website. I've also provided the email address for Mercedes Magaz, who is really going to be the project manager supporting and coordinating this community of practice. So if you have questions that you didn't really feel sort of that you could ask openly in the large group, but you wanted to get some greater clarification around any aspect of the community of practice, or also if you wanted to get some more information before fully committing or signaling your interest for participation, I would encourage you to email her. And also, if you have materials or worksheets or tools or anything that you think might be of interest to the broader community of practice, you want to send them along for broader dissemination, please feel free to send them to Mercedes with a clear indication for how we are permitted to share these materials. We won't necessarily know how we're going to house all of this yet, but just starting to collect this information and catalog it, I think will be very helpful as we, again, sort of build out this community of practice. And so with that, I just want to really thank everyone for attending. We know it's extraordinarily busy. We know that especially in June, there's so many different events that we're committed to. And so the fact that we had at one point over 160 people attend this this information session was just really, really inspiring for us. We don't have the actual dates set for the fall, but the moment we do, we'll make those available to you. And as I said, we're planning to have bi-monthly meetings starting in September, likely for somewhere around 60 to 90 minutes. We aren't entirely sure. And if you have ideas also for topics or issues that you want to bring forward for discussion, or if you have initiatives that you want to share with the broader group that you think might be of interest, again, please email Mercedes and let her know, and she'll bring them forward to the coordinating group so that we can sort of consider all the different options and opportunities and find ways to share the work that you're doing. Thank you very much. And thank you again for all of your participation. We really do look forward to seeing you in upcoming meetings and look forward to this journey together with all of you. Okay, take care.
Thank you, everyone.